All right, so let's continue with the muscles of the head and neck. This is a regional group of muscles. They're involved in moving the head and neck. They also allow or play a role in chewing and swallowing. The muscles of chewing are called the muscles of mastication. Mastication is the process of chewing. They either close the jaws or elevate the mandible. Remember, the lower jaw is the mandible. The masseter muscle and the temporalis muscle are very powerful muscles. They elevate the mandible for biting and chewing. If you've ever been chewing, say, gum or doing some chewy piece of candy or something, and you felt sort of a pain or a stretching or straining in the temporal area, that's the temporalis muscle that you are working. There's the temporalis muscle. There's the masseter muscle, and you can see where both of them are sort of locked in together. There is the buccinator muscle, again plays a role in chewing, and the orbicularis oris. Another medial muscle involved in chewing is the medial pterygoid, which assists the masseter and the temporalis with elevation, pulls the mandible, again that's your lower jaw, forward in a process called protraction, and side to side with the lateral pterygoid muscle. Again, the lateral pterygoid allows excuse me, for forward and side motion, also protraction of the mandible. And there are those two muscles. Excuse me. There's again the chart showing the origin, insertion, and principal action of these muscles. Stepped off camera just a moment to get something to drink, try to calm down the cough. The muscles of swallowing. Once the mouth closes, the chewing muscles can be grouped into those that push food back up to the back of the oral cavity, initiate swallowing in the throat, the pharynx, and pushing the food into the esophagus. Those muscles are the digastric, the stylohyoid, the mylohyoid, and the geniohyoid. All of those muscles attached to the hyoid bone, which we talked earlier about the hyoid bone's uniqueness. And these muscles all work together, pushing the food item toward the pharynx. Again, there's the thiohyoid, there's the hyoid bone, sternohyoid, omohyoid, stylohyoid, again attached up here. All of these bones, all of these muscles that have the word my or hyoid in them are going to be muscles that are attached to the hyoid bone. There's the thyroid cartilage of the larynx right there. That's the first component. That's the switching mechanism that switches between the esophagus and trachea. And there's a couple of more muscles that we'll talk about, the sternocleidomastoid, the sternothyroid. The tongue is composed of genioglossus, hyoglossus, and styloglossus muscles. Again, the Greek glossus refers to the tongue. The job of the tongue is to move the food so the teeth can break it down to a safe consistency for swallowing. Then it pushes the food backwards toward the larynx. All of these muscles of the of the hyoid bone, along with a couple associated with the sternum, the sternohyoid, for example, initiate swallowing. And there they are. There's the styloglossus, the stylopharyngeus, the stylohyoid. There's the hyoid bone. Again, you see all these muscles attached to the hyoid bone. Virtually the entire surface of the hyoid bone is covered with muscle attachments. And then there are those muscles' origins and insertions and principal actions. Muscles, again, did I skip a slide? No, I did not. So again, we've got some more side view now of some of those same muscles. There's the mylohyoid, geniohyoid, the hypoglossus muscle. There's the mandible, just the lower jaw. Again, these muscles are designed to push it forward and back, left and right, up and down. All of those activities involved very heavily in chewing. Then here we have some other superior pharyngeal constrictor muscle, stylopharyngeal. Again, pharyngeal refers to its attachment to the pharynx. Again, muscles of the head and neck, table of origins and insertions. And again, I know if you see a lot of muscles here, don't panic over that. As I said in the previous video, in the next few days, I will get you a list of about 30 to 35 muscles that I will expect you come test day to know the origin, insertion, excuse me, and principal actions. Large numbers of muscle actions in the chapter can seem daunting. Don't just memorize, use reasoning to understand their actions. So again, when you go back here, some of these muscles are going to be called middle lateral inferior pharyngeal constrictor. And that means they're going to be constricting, they're going to squeeze. Look at their names and see if you can get some type of understanding. Remember, the origin is the anchoring point most often. The insertion usually moves toward the origin. Therefore, when muscle contracts, it usually pulls its insertion toward its origin. Place the palm of your hand over the origin, fingertips of the same hand over the insertion. Pull your fingers in like you're pulling an insertion to mimic a muscle's contraction. In other words, do something like this, and that shows you how that muscle is working. Works even if you can't remember a muscle's exact origin or insertion. You can usually see which part is less movable and figure out the origin. Again, this is showing the medial pterygoid muscle that elevates and protracts the mandible. Muscles that move the head and neck, such as the sternocleidomastoid, the scalenes, the trapezius, the splenius capitis, the splenius cervicis, and the semperspinalis capitalis. And there they are. There's the splenius capitalis muscle, attaches on the mastoid process, moves down and connects on the processes of the vertebra. This is going to be the muscle that when it contracts, allows us to do this. Then we have the scalenes, the middle scalene, the anterior scalene, the posterior scalene, the sternocleidomastoids all work together to give us the ability to do this. So we have muscles that allow us to do this, and muscles that allow us to do this. And again, there is our chart showing the scalene muscles, the splenius capitis muscle, and the sternocleidomastoid muscles along with their principal actions. Remember the difference between flow. Like, what does flex mean? What does extend mean? What does rotate mean? Lateral, elevate. All of those terms that we had a little earlier are coming back now, telling us what this muscle actually does. The muscles of the vertebral column, critical for both locomotion and posture. Sorry about that. The erector spinae muscle is a group of muscles along the vertebral column in the posterior portion of the ribs. They are mostly powerful extensors of the spine, which allow lateral bending and rotation. So those muscles that allow us to do this and this. Those are the erector spinae muscles. The spinalis muscle, mostly medial muscle group, situated on either side of the vertebral column, contains the spinalis capitis, the spinalis cervicis, and the spinalis thoracis. The longissimus muscle is just lateral to this group. You have the longissimus capitis, the longissimus cervicis, and the longissimus thoracis. Notice the similar names. And the iliostalis, the most lateral group, again, the iliocalis cervicis, thoracis, and lumbroidum. The transversospinal group are deep to the erector spinae muscles. They fill in the grooves along the vertebral column between the transverse and spinous processes, hence the names. They're similar actions to the erector spinae group. And then finally, the quadralis lumbritum is a large, deep muscle which allows the vertebral column to extend and bend laterally. And then there is the figure of all the different muscles of the spine. Again, allowing our spine to bend forward, to bend backwards, what it will, and then rotate to the left and right, and also get that rotational movement. And there's the chart showing different movements of the vertebral spine. Back pain, one of the most common medical problems, which affects about 8 out of 10 people, me included, is usually a symptom of an underlying problem and not a diagnosis. Complex spinal anatomy makes diagnosis challenging, may be due to degenerated or herniated discs, compressed spinal nerve roots, muscle spasms, stretching or tearing of ligaments by trauma or improper lifting. All types of things could be the cause of one's back pain. I know exactly what causes mine, and as long as it's bothering me the little bit that it is bothering me, I'm not having it repaired, because the fix is a major surgery fusing two vertebrae together, and then I don't want to do that if I don't absolutely have to. Risk factors of back injury: age, obesity, poor core body fitness, genetics, and occupation. Prevention: you should be aware of the risk factors. Adopt healthy practices to protect your back. Treatment: most of these things will go away on their own or with over-the-counter medication. Persistent or severe pain requires medical attention. Again, one of the things that you do if you have back problems and you go to a physical therapist, they will do a lot of core exercises, building not only the muscles of your back, but also the muscles of your abdomen and your rib area. All right, we're going to stop there, and we will pick up in a few minutes with the trunk.